Welcome to this Patient Empowerment Network program. I'm your host, Lisa Hatfield. In this unique program, we explore cancer care and technology, specifically the importance of specialized care in myeloproliferative neoplasms, MPNs for short, and the role of digital health in symptom management. Today, I'm joined by two incredible experts. Dr. Krisstina Gowin is a hematologist-oncologist treating MPNs. Dr. Gowin is assistant professor of medicine at the University of Arizona. And Dr. Gowin, it's such a pleasure to connect with you.
Oh, it's such an honor to be on today and connect with you all. Thank you so much for having me.
Also joining us is respected oncologist, Dr. AnaMaria Lopez, professor of medical oncology at Sidney Kimmel Cancer Center, Thomas Jefferson University. Dr. Lopez is a telemedicine pioneer as the founding medical director of the Arizona Telemedicine Program. Welcome, Dr. Lopez. Thank you for being here.
Thank you so much. So looking forward to the discussion.
Thank you. So Dr. Lopez, I'd like to start with you to talk about cancer care and technology and how far we've come with technology and cancer care. We've made a fair number of strides in cancer care as they relate to digital health. Can you speak to that a bit?
Sure. I always say that the COVID pandemic allowed us to advance telehealth in a couple of months, what probably would have taken 70 years. So, we went from maybe 10% of the visits being done through tele to 90% plus. So a huge, huge change and a lot of lessons learned, both in the how do we do it clinically, as well as how do we integrate this? How do we integrate this into clinical trials? And to move beyond, we really thought telemedicine and really thinking telehealth, because there are so many technologies. So there could be monitors. There could be, a lot of us were doing work in patient-recorded outcomes. How do you integrate that? How do you make it easy for patients to use this? And maybe it's not simply the patient, but it's also the patient and the caregiver who can help with this reporting. So what are really the implementation efforts that need to be done? So I could go on and on because there are so many lessons learned, and it really shook things up. So people are thinking of this as a new technological revolution. So technology plays a big role in care, and certainly a very big role in cancer care.
And just out of curiosity, Dr. Lopez, do you have a lot of your patients who still continue to see you via digital health or telehealth who prefer that?
Yeah, so for example, in some of the psychiatry literature, which I think is a little bit unexpected, right? Because you think psychiatry is such an intimate interaction, where a lot of patients actually feel safer when it's digital, when it's through tele. So yeah, I do. And we were talking earlier about doing integrative medicine, and almost all of my integrative medicine patients we do at a distance. I really think of it as it's a way to bring back the house call.
Yes. Well, thank you for that overview, Dr. Lopez. So the pandemic has resulted in significant changes to many aspects of daily living for many of us, but for patients living with cancer, like myself, there are different realities that we've had to deal with. Like, do we go in for our monthly blood draws, or do we wait a couple of months? So question for Dr. Gowin, can you give us an overview of the impact that COVID-19 has had on MPNs or MPN care?
Absolutely. Well, there was a really wonderful study that was done, really led out of Mayo by Jean Palmer and Ruben Massa, and it was an international study, and it looked at 1,500 MPN patients. And they asked questions like, how many of you are actually having telemedicine? And this was in 2020, kind of at the beginning. And over half of them had already been engaging in telemedicine. And about a quarter of them felt that their care actually was delayed a little bit, and that there were actually consequences to that delay. So that really speaks to an international kind of change in the paradigm of how we're delivering care for MPN patients. The other thing is the lockdowns that were occurring for us here in the US and really internationally. And what they did is they asked patients their MPN symptom burden. And those that were on lockdown, not surprisingly, I think to all of us, had a significantly higher symptom burden. So I think that really speaks to that, yes, there was a very large impact of COVID on the development of telemedicine and the need for telemedicine, but it also underscores the need for symptom management, that we now have a group of patients that are having a higher symptom burden, probably likely secondary to more sedentary behavior, more anxiety, more depression, but a higher symptom burden because of COVID. And so we really need not only more therapeutics and perhaps non-pharmacologic interventions to support their symptom burden, but it needs to be delivered on a digital platform.
Thank you for that, Dr. Gowin. So you brought up a really good point, and this is a great segue to talk about integrative health. So I have multiple myeloma, and of course that comes with side effects from the different therapies and symptoms of their own. We have a great integrative health center at our cancer center here locally where I live, and I've used it for acupuncture for some of my symptom management. I've also watched you on different platforms through webinars and patient support groups where you describe different integrative health techniques and that type of thing. So I'm wondering two questions. The first part is, what symptoms do MPN patients face the most? And then how can they use integrative health to do that, particularly as it relates to telemedicine? Are there telemedicine options for integrative health? I suppose things like acupuncture, maybe not, but other types of integrative health. And can they get a consult for integrative health? Can they even go as far as getting a consult? So if you can answer those questions, the symptoms they face, how to use integrative health, and if they can get a consult for integrative health, that would be great. We'd appreciate that.
Yeah. Well, Lisa, I want to take a moment just to validate your journey that you're going through and to congratulate you for your self-advocacy to go look for those integrative therapies to support yourself. And for MPN patients, I will say that it's a really unique group. And so, all cancer patients experience symptoms. But in myeloproliferative neoplasms, it's really kind of this heterogeneous, what we call a symptom burden. And so patients, most patients will experience fatigue, about 80% of MPN patients. But then beyond that, there's really a whole slew of different sequelae that can be associated with the disease, which you may or may not think about when you're thinking about MPNs, such as psychosocial issues, sleep issues, sexual issues. And then we have kind of the classical issues that happen with MPNs, such as dizziness, but we talked about the fatigue, bone pain, itching, abdominal discomfort from an enlarged spleen and early satiety or feeling full quickly. It's really a huge symptom complex, if you will. And we now have validated measurement tools to better understand those. It's the MPN symptom assessment form, which is really, I think, revolutionized how we look at MPNs. It's no longer just treating the blood counts. We're treating the patient as a whole. And even within our NCCN guidelines, kind of how we as oncologists go through the algorithms of how to change therapy and how we look at patients, we now have symptoms in there. So even if blood counts are controlled, we may change therapies or even do a bone marrow based on symptoms alone. So symptoms are a huge thing in MPN. So getting to your second question for integrative health. So I think that MPNs, the patients in the community are really early adopters for digital engagement, which is fantastic. Everyone's very engaged. And I've had the opportunity to work on meditation apps, yoga apps, a wellness-based app here from the University of Arizona. And patients just really accrue fast. Everyone's so excited. And most of these, though, were very small kind of pilot trials looking at feasibility. Can we really do these things? But most of them as well are showing some impacts on depression, anxiety, sleep, and total symptom burden. So I do think that these modalities through digital platforms certainly can make a difference in the symptoms. And we've seen that with meditation. We've seen it with yoga, and we've seen it with the 7-domain wellness app. And is it the digital engagement? I don't think so. I think it's likely the integrative therapies that they're receiving through that platform, right? We know meditation works. We know yoga works. Perhaps not so well in MPNs. We need to build that evidence base, but other solid cancers, we know those interventions really work. But it's wonderful to get that kind of early data, say it not only works, but it also works when you're doing it at home, when you're doing it on a digital platform. And so I would encourage all patients listening to this to, yes, look at what's around you. What are the resources? What are the clinical trials looking at these different digital modalities for integrative medicine, but also to go get a integrative consultation. And as Dr. Lopez already had mentioned, she does all of her integrative medicine via telemedicine now, which is fantastic. And so it's at, your fingertips. You now have access to wonderful oncologists like Dr. Lopez to guide you in this journey. And the journey is not only allopathic Western medicine, but it's treating you as a person, you as a whole symptom complex. And that's really what integrative medicine aims to support you through.
Thank you for that, Dr. Gowin. So you talked about an app that patients can use. Is this app accessible to any patient, or is it just within a trial or study that you've done?
No, it is widely accessible. It is free, even better. It's called My Wellness Coach.
And I'm writing that down. Okay.
Yeah. Yeah, it's really wonderful. Many domains of wellness. It's based on motivational interviewing and SMART goals. It gives you little reminders of, hey, and you set your own goals, which is wonderful.
And what types of interventions then does that contain? Does it have things like you said meditation, and does it have a yoga program for patients, or what types of interventions?
Not quite yet. I think that's what we aspire to, is really this multi-dimensional intervention. It's not really an intervention. It's looking at your life. It's saying, what are you eating? What are your nutrition goals? How are you moving? What are your exercise goals? How is your resiliency? How is your spiritual health? How are your relationships? And so it's asking all of these domains, or what our wellness is, and helps to identify where perhaps you would like to devote more time and energy to, and also give some resources and education around each of those domains and why they're so important. But you set your own goals. And
that's
then
great.
Accountable for your goals.
Great. Well, thank you so much for that information. And you mentioned that Dr. Lopez also does her integrative health via telemedicine. So I'm going to ask Dr. Lopez, can you speak to that a little bit more? How do you do that with patients? Do they just contact you and set up an appointment for an integrative health consult or appointment? And do you conduct some of that yourself, or do you send them to particular resources in the community?
Sure. So yes, patients can make an integrative oncology appointment directly. I really like to do the consults through tele, simply because I can, as I was mentioning, it's like a virtual house call to really get a sense of the patient. Often a partner, significant other, caregiver, might be present as well. And as we know, there's the survivor and there's the co-survivor. So including both can be very helpful to some people. And I think the initial intake, again, as Dr. Gowin was saying, it depends so much on what the person wants to do. So the first opportunity for coming together is simply, where are you? What are your goals? What's important to you? And of the panoply of options, which might be the easiest, or the one that you are most interested in. And so depending on what it is, we might work together. We might also bring in others, if the person is really interested in making lifestyle changes, let's say related to nutrition, the person might work closely with a nutritionist for some period of time and then come back, and we'd come together and reassess. You mentioned the acupuncture, and you can't do acupuncture at a distance, but you can certainly teach people about the points and consider acupressure for certain points. So there's so many ways to engage and interact. But yes, I think like a lot of medicine, it's a team-based approach.
Great. Thank you, Dr. Lopez. I do have to say with acupuncture, one of the side effects of a lot of the cancer medications is neuropathy. And a lot of patients like myself try every option, every pharmacological option, whether it's gabapentin or something else, and they don't work. And acupuncture, for me anyway, personally, I had a significant reduction in the painful neuropathy, not so much in the tingling, but a significant reduction in that. So I am a very strong advocate for integrative health. So thank you for explaining that a bit more. And as long as we have you on, Dr. Lopez, can you also speak more broadly to innovative telehealth tools that are making an impact on symptom management and overall cancer care?
Sure. So one of the things that we know, is that, for example, people have appointments every 3 weeks, or they have appointments once a month with the oncologist, and a lot can happen in that time. So setting up systems that are assisted by technology so that patients can report their symptoms in real time can be very helpful. And, some of this may require, it may not be a common way where the person may be familiar going to a computer or going to their phone to kind of say, this is how I'm feeling. So that may require some engagement, education, but often, regardless of age, regardless of background, people find that really easy and find that so helpful to be able to say, oh, was it 2 weeks ago that I had that? As opposed to just saying, hey, I just had this. And then it can happen, anytime, day or night, that the patient can report. And that way it's just so helpful to have an intervention in real time. The other part that's good is that often some of these systems can kind of track. So, we can look at it together and say, you know what, your fatigue tends to be a couple of weeks after therapy. So how can we either prepare for that, or just to have the reassurance that, yes, you have that dip, but it gets better and you get through it. So being able to look retrospectively and identify that can be helpful. And I think also just the ease for people to be able to connect with multiple specialists, sometimes to have multidisciplinary visits where not only does the patient meet with everyone, but the patient can see that we're all meeting and interacting together. So all of those are incredible tools. One of my favorites is patients are in the hospital, and patients are in the hospital a long time, on some occasions. So, and even if a person's not there a long time, it can feel like a long time. So to use the technology, not just to connect the patient, the healthcare team, but to use the technology to connect the patient with his or her family. And I think especially, a lot of people have, smartphones, but, it's using your minutes. Sometimes the internet may not be so strong. So to use the technology that would be used for the clinical piece, to have that available in the inpatient setting so that patients can feel connected.
That's a really great thought that you brought up too. I know when the pandemic was in full swing, but patients were starting to go back into the office to see their provider. For me, I was not allowed to take my husband in with me, so I went in alone. I was far enough along in my journey. I didn't necessarily need a care partner with me, but some patients do, maybe a newly diagnosed patient. So that is a really great point. Say a patient has to come in by himself or herself. Is that a technology they can use? Are you willing to let them use their phone to maybe FaceTime during that call? Or we had to use the actual physical landline because my phone did not connect. The signal wasn't strong enough. But do you allow that during your appointments to have patients contact somebody? Okay, that's great. Yeah.
And also, there's pandemic, but there's also people live everywhere. So you could say, their son could be in California and I'm in Philadelphia. And this way, it's okay. We'll just beam them in.
Yes, well, thank you for that information. And some patients might be a little more reluctant to use telehealth or telemedicine. How can patients and their care partners feel more confident in voicing their concerns or communicating with their healthcare teams regarding any telemedicine options that are out there?
So you mentioned that I had been the founding medical director of the Arizona telemedicine program. And it was such a wonderful experience because skepticism, and I really respected that, right? It was brand new. And we had our system in the library, and the library, it was down in the basement. So it was very metaphorical. You know, I would meet the new clinician at the entrance of the library. We would walk down the stairs together. And, you know, often the conversation was, okay, I'm doing this for you, you know, I'm doing it one time, you know, we'll see how it goes. And I was always so reassuring that if for some reason, because ultimately the clinician needs to feel comfortable, yes, this works, or no, it doesn't. And if you have any doubt and you feel that you need to see the patient in person, you just need to say that. I need to see the patient in person. And inevitably, as we're walking up the stairs, oh, you know, I know you called me because I was on call. Just call me anytime. Don't call the on-call person. This was great. I loved it. So inevitably, people really like it. And it's good. You see the patient in their own environment. You can interact. You often get insights that you may not have gotten otherwise, just because of where you are and how comfortable they feel in their own space. So I think for me, it's the proofs in the pudding. You know, give people the opportunity, support, have the right supports and technology in place, and often it's a very positive experience.
Great. Thank you, Dr. Lopez. So, Dr. Gowin, a couple of questions for you. Is technology playing a role in accelerating progress in MPN care?
Oh, absolutely. And I think, you know, some of the ways that it really accelerates progress is pulling us together, right? So what we need to recognize is that myeloproliferative neoplasms truly is a rare disease, and we just celebrated Rare Disease Day. But there's a lot of challenge in treating patients and progressing the field forward in rare diseases, because it's you can't do the big clinical trials. It's hard to come together because everything's siloed, and there's just, you know, a couple patients here, a couple patients there in each practice. But with digital health and clinical trials that are offered on a digital platform, it pulls the nation together and even the world together. And we've seen that. I've done a international survey-based analysis, and I had 858 MPN patients from 52 countries participate in that survey. And so that just shows how it pulls the world together. And for the web app that we just discussed, we had 93 patients say they were interested within 3 weeks. And within actually a week, we identified them all, and then took 3 weeks to actually accrue them to the trial. So it really speaks to how MPN patients are digitally engaged and excited about these kinds of platforms, and then B, how effective it really can be to pull the groups together. So yes, I think it's and that's really how we're going to get progress, is through these kind of interventions with a rare disease. I hope it's okay if we jump back to something you said, Dr. Lopez, which is, I think telemedicine is so important to bring everyone together. And in particular, I see that on the transplant ward. And so in myelofibrosis, that's the only curative therapy, right? And so many myelofibrosis patients actually go through allogeneic stem cell transplantation. And my goodness, that is a socially isolating experience. Patients are in the hospital, not uncommonly, for at least 30 days, and then have to be near their transplant center for 3 months, which often is away from home. So to pull in their support system, both through the acuity of the transplant themselves and then the couple of months after, is so crucial to a successful transplantation. And I think through FaceTime and also the MPN support groups, which is very robust, the patient advocacy and the way the MPN network sticks together on a digital platform, I think is really unique and offers unique support.
Thank you. And then what role does technology play in the disease symptom management and in particular in clinical trials too? What role does technology play with clinical trials?
Well, I think it helps us through different clinical trial accrual patterns, we can see who's eligible where. So it helps us identify patients. It helps us to understand the different kind of precision-based medicine approaches, so we can start to pool the data, say for particular mutations, ASXL1 mutations, right? And so it kind of helps us in the precision medicine aspect of clinical trials. And now we're looking at symptom management and how do we really integrate that? So large survivorship platforms like CareVive, if you've ever heard of CareVive, is now integrating our validated symptom assessment form into the CareVive platform. So now we can really collect that data and use that to mine it for potential kind of retrospective analysis. So it's helpful for clinical trials as well as for our clinicians in clinic to really identify changes in symptom burden, just as Dr. Lopez was mentioning, that we can track these over time and it can flag and say, oh, your symptoms are changing, they're increasing over time, and maybe we need to be thinking about that. And so CareVive is really kind of a electronic medical record driven, it's really a healthcare driven platform, but now there's patient ones too. And I just learned about this 2 weeks ago. I was at an MPN conference in Phoenix and learned about MPN Genie. And so MPN Genie apparently is tracking, patients are putting their symptoms in, and that's shooting that information to the electronic medical record to their doctors. And so I think that's fantastic, right? Because, we now get that information real time and we can change our clinical management, maybe bring that patient in sooner, maybe do a bone marrow earlier, right? We never would have identified that if it weren't for those kind of digital engagements. So I think it's a really exciting time, and I think we're going to see more and more of these new kind of platforms and ways for different EMRs and smartphones to be communicating back and forth between patients and providers.
Great. That MPN Genie is fascinating to me, that we can have that real-time communication going back and forth. As a patient, I would love that. So going back to clinical trials, I'm curious if you think that technology has progressed enough. So in the past, say I'm an MPN patient or a myeloma patient, I see a clinical trial or hear about one, I have to be on site for that clinical trial for monitoring, maybe for 6 months to a year. Do you think that technology has progressed enough that clinical trials might allow a patient to be at home, maybe in a more remote area and monitored remotely, whereas in the past that same clinical trial required them to be at the facility? Do you think that we've progressed to that point in some clinical trials?
You bet. Yeah, I think COVID out of necessity has forced us to do that. And I have in my own clinical trials, even with pharmacologic clinical trials, conducted telemedicine visits that were approved by the sponsor. So the paradigm is shifting, and particularly when it is oral therapeutics, I think that's really accessible. When they're, IV subcutaneous, I think that has different challenges. Obviously, you can't do that as remote, but when they're oral therapeutics or non-pharmacologic interventions, such as our integrative interventions, I think it really lends well to a more remote experience.
Okay. And then would that require communication between the local oncologist and maybe someone like yourself, the investigator on that clinical trial, to know what is going on with that particular patient? I assume that communication would be ongoing.
Absolutely, always.
Okay.
Yeah.
All right, great. Well, thank you for that information. So Dr. Lopez, kind of a similar question for you. What are some examples of how technology is influencing cancer care right now?
Yeah, let me just add on the clinical trial question.
Oh, yes.
that there's also the opportunity. Again, there were so many things that we thought, oh no, it just can't be done. But because of the necessity, necessity is the mother of invention. We do remote consent. So that was a big deal in the past. We can also do a televisit ahead of the appointment and screen for the cancer clinical trials. People travel large distances for studies. And instead of traveling 4 or 5 hours and then to be told, oh, actually, you don't meet the criteria, to be able to do all of that at a distance, to get the records, to get the images, to review all that needs to be reviewed, and then to say yes. And not only yes, but we can also do your consent at a distance in some situations. And then when you come, there's actually the more substantive, perhaps even the treatment. There's also a large movement around hospital at home, and that these patients that are eligible for that would be able, with digital support, be able to get hospital level care in some cases at home. So some of that may involve infusion, some of that, again, but that visual connectivity. And in the past, you really had to kind of conceptualize it, and it was kind of space agey to talk about it. But we've all done FaceTime. So I think we all really can understand what it entails. So tremendous shifts, and we want to try to keep that momentum going for our patients. So I do think that there's so many ways that technology has impacted cancer care. Even when we talk about the electronic record and patients accessing the electronic record and patients having the opportunity to go into a portal and to see their labs, to see their reports, to be able to track their changes. All of that is really, really powerful. Patients with, the most common, I think, is patients with diabetes who track their blood sugar, sometimes to the minute, and they can say, oh, I ate that, and now I see the impact. So the opportunity for monitoring, the opportunity for also bringing in experts. So let's say, there's a patient with a rare disease and the expert is elsewhere. There might be the opportunity to bring people together. We do tumor boards. That's just part of what we do in cancer care. And also, as many, there are health systems now, so that it's not one hospital, it's multiple hospitals together, where we can bring all of those folks together, bring in local expertise, regional expertise, national expertise, all for the patient's benefit. So there are so many ways that technology, even something as simple as the note. Now, this is something we experimented with, and it's still in experimentation phase, but there were these Google Glasses where you could interact with the patient, and as I'm talking, the Google Glass would record kind of the conversation and would come up with some sort of a structure for the note. So for what that encounter had been like. So there are lots of ways of how do you capture natural language in real time to really help the workflow, the documentation process. So I think there's aspects to help the patient, to help the families, to help the clinical teams, and to help everybody work together.
Great, thank you. And you talked about the patient portal, and I'm one of those patients at fault of seeing a lab result before my doctor saw it and calling him or sending a message via my chart saying, hey, this is going up, what's wrong with this? So I'm sure you don't have to mention any names. I'm sure you've seen the challenges of digital health too, or having that patient portal accessible to patients. So anyway, just thought I'd throw that out there, that I'm sure that brings challenges to you also, a few little challenges here and there.
But at the same time, that's so good, right? It's so good that patients are engaged. It's so good that you're engaged. And I think as long as, we're communicating that, yes, you may see this before me, so you may have questions, and then, we just get together and answer the questions.
And thank you for saying that, Dr. Lopez, because a lot of us patients who do that occasionally feel a little bit guilty for sending a note right away to our doctors. We know you're busy. We know you'll look at those labs. If you're concerned, you'll call us or let us know. And sometimes we jump the gun a little bit. So thank you for reassuring us that that's okay, to do that. So we appreciate that. So, Dr. Gowin, do you have anything to add on how MPN care or just cancer care in general could change with different technologies? We didn't touch a lot on things like artificial intelligence and that type of thing, and we can speak to that or any other type of technology that you're familiar with.
Well, I think it's the artificial intelligence aspect is really going to change the paradigm again on how we're designing studies. And I think one of the biggest challenges that we have in myeloma and as well as myeloproliferative neoplasms is to think about how do we optimally sequence our therapies to achieve best survival, right? And I think this is a wonderful problem to have. We have now not only one JAK inhibitor on the market, but several and more in the pipeline and several other therapeutic targets. And so now the question is, which therapy and when do we employ it? So things like artificial intelligence will help us to answer that question with machine learning, decision tree analysis. All of that is going to be answered through those kind of platforms. And so I think that is going to be a shift we will see in the next 5 years, is many different machine-based learning algorithms to better understand those problems we cannot have tackled traditionally otherwise. Sensors, though, is another one, right? And so a big thing in MPNs is not only addressing the blood counts and reducing risk of thrombosis and to address symptom burden, but it's really addressing lifestyle, because it's things like cardiovascular disease, stroke, that really we're worried about as some of the sequelae of having the disease and what we're trying to prevent with therapeutics. And so even going back to this NCCN guidelines, it's addressing cardiovascular risk factors as part of our core treatment goals. And so how do we really do that? And it's really through lifestyle medicine. And that's where the sensors come in. And so now we have, these Fitbits and smartphones that connect to our Apple Watches, and we have Garmin's and all these wonderful devices that are prompting us to move more, prompting us to be cognizant of our heart rate and stress response, prompting us to meditate. And so I can envision those evolving over time and connecting to the EMR and being very seamlessly interwoven into our clinical trials. And we're already doing that. In fact, we're talking about doing one very soon in MPN patients. And so I think the sensors are going to be another big way that we're going to be integrating into our clinical trials and symptom management tools.
That's fascinating. Thank you for that. And Dr. Lopez, do you have anything to add about other technologies and how they may affect cancer care in the future?
Sure. When Dr. Gowin mentioned the sensors, it just reminded me, we're building this new building, patient care building, and oncology will be there. And I did a tour recently, and we're used to, you go to the doctor, you stop in, they get your blood pressure, they get your weight, etc. Here, you'll walk in directly to your exam room, and it'll be, you check in at a kiosk. So you just kind of check in with a little robot kiosk, and then it'll tell you where you're going. You'll, go to room 3, let's say, and room 3 will say, welcome, Lisa. And so you know that you're in the right place. And, you'll walk in, there's your gown, you'll sit in the exam chair, and the exam chair automatically is going to take your vital signs. So it just seems really, these built-in aspects to the technology. And one of the things, again, what I just love about this work is that it's a very interdisciplinary, multidisciplinary. And one of the projects that we were working on, which ties into this, when I was in Arizona with the telemedicine program, is we worked with the College of Architecture. and with this concept of smart buildings. So it's kind of like that, right? Why should you do these different sensors that detect, but that it could also detect, you might walk into the room and you might be really nervous, and so you might be really cold, and it would detect that, and it would warm the room for you. Or you might be coming in and be having hot flashes, and it would just cool the room for you. So the technology has so much potential to really improve the patient experience.
Mhm. And that's amazing to me. I think that would be incredible to walk into a building, to have that experience, as long as it doesn't take away the compassion and care I get from my providers. I am so fortunate to have extraordinary providers. So I don't think it will ever take over that aspect of it. I think that is a fear people have, especially with artificial intelligence and that type of thing. I think it can only go so far. Can't provide the humanness that's required for patient care. So
Yeah, these are tools.
yes, that's great. Well, thank you very much. So, Dr. Gowin, can you provide or share some examples of how telemedicine is influencing personalized medicine and MPN care? And how can MPN patients best advocate for themselves to get the latest in MPN care?
Well, I think it's going back to some of the conversations we've already had, is that now with telemedicine, you can really access academic centers no matter where you are. And so rural areas now can go to academic centers very accessibly without travel. And so what that lends to is more access to precision-based clinical trials. And very often now we're doing next generation sequencing panels for patients with MPN. We're looking at what are the genetic features of the disease, and we may be accruing trials based on those genetic features. And so that kind of conversation really only happens at academic centers. And so I think it's really allowing those that live far away, a few hours away, to really have those kind of personalized and precision-based conversations. And then tying in again the aspect of integrative medicine, and that what is integrative medicine is all about is personalizing your treatment plan, asking what are your goals, what is your lifestyle, what is your culture, and how do we really get you on a plan that makes sense for you, that is local for you and sustainable for you to really achieve your optimum wellness. And so if I were counseling patients listening to this, I would say, start with the in-state academic centers and say, what are the telemedicine services there? Is there an integrative medicine department there? And then get a quarterback within that department and say, okay, this is the plan. And then that quarterback can say, well, now let's look local. What do you have? What are your resources there? Let me do some homework with you and hook you up with really evidence-based, high-quality providers to achieve your personalized needs in your local community. And I think that's how we're really going to get all of our patients on a precision and personalized kind of approach, no matter where they live. And that's, again, the beauty of telemedicine and digital health.
Great. Thank you, Dr. Gowin. And I know we've spoken, both you and Dr. Lopez have spoken to all of the rewards of telehealth. Are there any risks or drawbacks that you see to telehealth or telemedicine?
The most important thing is to remember that the technology is a tool. And if the person feels that there's a limitation, so for example, if the patient is seen and they say their heart is racing or skipping beats or something. Now, there are electronic stethoscopes, so you can really do a full exam except for palpation through telemedicine. But not everybody has that, even in a clinic, right? But certainly in our own home, we don't have that technology. So if a patient is expressing a concern for which the clinician really feels, that needs a closer evaluation, then that's the right next step. So the technology is a tool to help us care for people. And it may not, if it's not all available right there, then we need to see the patient in person. So I think that's the risk, is just sometimes, people may feel limited, like, oh, well, I'm not really sure. That's okay. I'm not really sure I need to see you, or you need to go here or go there for the care. And the other, which is a really big threat, is that part of the reason we did 70 years work in a couple months is because it was reimbursed. And we're reaching the end of the pandemic, the federal, and with that, the payers may go backwards. We all know that if that happens, we will go backwards in telemedicine. There will just be decreased use. And it may lead to people then going back to traveling 4 hours, waiting, only to be told, oh, you know what, there's not this clinical trial doesn't work for you. So we don't want to lose ground. And part of not losing ground is that we really need to continue to have advocacy around reimbursement.
Thank you, Dr. Lopez. And I feel compelled just to follow up with one more question regarding that, because I'm very passionate about this. With some of these rules and guidelines coming to an end, I know in my particular state that I will no longer be able to access my specialist. I see a myeloma specialist. We do not have any here locally. I can access a specialist via telemedicine. I will not have that opportunity. So as all of us know, there are disparities and there are financial disparities in cancer patients. There are racial disparities in cancer patients. There are socioeconomic disparities. Telemedicine has been has had a tremendous impact on the care and the outcomes and the quality of life of so many patients. So as a patient and as an advocate, do you have any recommendations? Do I go to my doctor and say, okay, how can I move forward and still talk to my specialist who's out of state? Do I go to my state legislature? Do I talk to my insurance company? How can we get this to continue? Because this has had such a significant impact on the quality of life and on the outcomes for patients who otherwise would not have been able to access that care.
Yeah, I mean, I think all of the above, partnering with other advocates. The American Telemedicine Association has a map that kind of says where are all the shifting sands regarding the different rules and legislative changes. But I think it's led us to a place where we are all advocates, and where physicians, nurses, patients, pharmacists, everybody, in the same way that we do team-based care, that we do team-based advocacy, and it's all for our patients.
Great, thank you for that. Dr. Gowin, any last words that you may have about accessing specialists or telemedicine options?
Well, I think we covered the basics, but I just want to end with just how empowering the access to digital health interventions really is. And so, I don't think there is a one size fits all approach to every patient. So, what I would encourage patients to do is just to really think, how do I complement my care? What am I missing? How do I achieve my best wellness? And how do I get those resources in my home to make them more convenient for me, and to start doing some research and self-advocacy to really get those resources, because they are out there, and almost in every domain, there is now a digital version that is accessible to you now.
Thank you for that. So it is time to wrap up our program. I could ask you many more questions. From a patient perspective, it has been so refreshing to take a minute to understand how far we've come and to have a look at the exciting innovations ahead. As always, we appreciate all the new tools being added to the toolbox. And I am eternally grateful for Dr. Gowin and Dr. Lopez and all providers who are willing to come on these webinars and answer questions from patients. It is so empowering to us, and we're so appreciative of your time and your energy and your expertise. So thank you so much for being here today. And just a reminder to all patients to always consult with your medical team about what is right for you. Thank you again so much to Dr. Lopez and Dr. Gowin for joining us for this Patient Empowerment Network program. I'm Lisa Hatfield. Thank you.
Thank you.
Thank you.